How y'all doing again? This is Mr. Golf. We back at it. This time we're gonna be doing measuring blood pressure, recording blood pressure. Got it? A couple things I want to let you know before we get started. Some key things. Good. How to identify what cuff you would like to use. Good. If you look at the indicator right here, this white line, you want to make sure this white line is within the range. So if you put this on, say my arm, good, you want to make sure that the white line is within the range. If the white line go outside the range, then you would need to move up in blood pressure cuff because this would be considered too small. Good. Once you move up, you have what they consider to be adult size, and then you consider this to be what? A large adult size. Got it? So it's the same thing. Once you have the blood pressure cuff pushed on the person's arm, you want to make sure it's within the range. If it goes outside the range, then you need to move up in cuffs. Good. Another key thing you want to know is about the stethoscope, the turntables. Got it? Good. When we use our turntables for blood pressure, we want to make sure we use the large diameter side. Got it? Good. But understand, this is a dual turntable, so it has a large side and a small side. And what you want to make sure is that when you look into the eye, you see that the metal is showing. If the metal is showing, then that means that this side is open. If the metal is not showing, then that means this side is open. Okay? Good. So you always want to make sure that the metal is showing, so that you'll know that this is the large side. Another way you can check is by placing the stethoscopes inside your ears and just tap on it slightly. You should hear a loud thump. Got it? Good. Now, another thing is that locating the brachial artery. Good. You want to take your two fingers, go on the pinky and the ring finger, and go up the arm to the crease of the arm to locate the brachial artery. Got it? Good. Some people do like this. Good. Remember, when you do like this, one of your fingers is not on the crease. So try to turn it sideways so you can capture the blood vessel, so you can actually feel the beat. Once you feel it, leave an indentation on the arm and slide it out because it gives you a lot of surface space. Got it? Once it gives you a lot of surface space, make sure the indicator of the blood pressure cuff is pointing to where you actually felt the brachial artery. Got it? Good. So let's get started. Give you a few pointers, maybe that will help. But let's start on the skill itself. Good. How you doing, Mr. Johnson? My name is Mr. Golf. I'll be your CNA today. Before I get started on checking your blood pressure, I'm gonna go wash my hands, put my gloves on, provide privacy. Okay? Good. So I simulate washing my hands, I put on my gloves, and I provide privacy before I gather my supplies. Make sure you cover the bed with the privacy curtain. Good. I choose my blood pressure cuff. I choose my stethoscope. I'm going to ensure that the metal is, I see the metal, and then I'm going to get my alcohol pads. Good. If you got a bedside table, bring that close to the bed, put your items on it. Good. Got it? Now I'm going to take my two fingers, go up the arm to the crease to locate the brachial artery. Once I find the brachial artery, I'm going to move his arm out here. Good. I'm going to take my stethoscope. I'm going to take my blood pressure cuff, and then I'm going to place the indicator where I've found the brachial artery. Good. Once I place the indicator there, I'm going to lift it up slightly, and then I'm going to wrap and make sure this blood pressure cuff is snug on the arm. Good. I'm going to set up my blood pressure cuff, have him hold it so that me and the proctor can see. Please, key notes, when you pump up your blood pressure cuff, make sure it goes to 160. If you hear the beat at 160, good, tell the proctor that you're going to pump it up to 180. If you hear the beat at 180, tell the proctor that you hear the beat at 180. And then they will give you the green light to move it up to 200. Please remember, you must inflate the cuff to 160. If you pump it up past 180 to 200 without letting the proctor know, they can stop you and tell you you have created a safety risk, which can fail you. So now the next thing I'm gonna do is clean off my stethoscope. Good. I'm gonna clean everything in silver and white. And you're gonna clean your side and the proctor side. And then I'm gonna clean off my turntable, everything in silver and white. I'm gonna give the proctor theirs. And I'm gonna take mine. When you place your ears, these are the ears, when you place them inside your ear, you want to make sure your ears are pointing away from the eyes. You do not want them pointing towards the eyes, because that means you're putting them in the wrong way. These have to sit flush inside the ear canal. Like I said before, you could check with a soft thump and place the turntable exactly where your arrow is. Good. Some people hold over top, some people use 2 fingers, but you want to ensure that the drum is touching all of the skin. The key thing about blood pressure is that you want to make sure you understand how to work or use the valve. Good. If you turn towards the right, this is my right side. If you turn towards the right, good, it's going to allow you to air inside the what? The sphygmomanometer. Good. If you turn it towards the left, it's going to release the air or the pressure. Good. So I'm going to slowly pump this up to 160. And I'm going to slowly release. Once I hear the last beat, I'm going to release the air from the blood pressure cuff. I'm going to take all my items, place in a designated dirty area. Okay, I'm going to throw away my trash. I'm going to remove my gloves, wash my hands. At this moment, when I wash my hands, I now can record. So his blood pressure was 146 over 82. Good. And I'm going to put BP behind it. Good. Once I write it down, good, I'm going to give him his call bell. Make sure the bed is in the lowest position. Good. I'm going to place my table back where I found it. Good. I'm going to release privacy. I'm going to document task complete.